Effects of CTGF on CD146 plus stem progenitor cells in periodontal ligament. For technical English by Sharon Carriel. Definition. Tissue engineering is an area of contemporary science based on the principles of cell biology, bioengineering, biomaterials, biochemistry, and biophysics, focused on solving the clinical and surgical problems derived from the loss of organs or tissues and their functional defects. Postnatal mesenchymal stem cells of the periodontal ligament express surface markers such as stroll, CD105, endoglin SH2 antigen, CD146, MUC18, and CD166, Alcam SB10 antigen, and have a pluripotent ability to differentiate into adipocytes in vitro, osteoblasts, cementoblasts to form the periodontal insertion tissues when transplanted into immunocompromised mice. Cells with the characteristics of the supposed mesenchymal stem cells have been found in the regeneration of periodontal tissues, which implies their participation in periodontal regeneration.
If you like the video, please don't forget to subscribe and press the bell icon to get notified on every new upload. Assalamu alaikum. Let's come to the periodontal ligament traction theory now. So as the name says, there is some kind of force that is generated by the periodontal ligament and it causes tooth eruption. Now let's see what it is. So we all know that we have dental follicle and we have a teeth associated with that follicle. Let's say this is the teeth. So various experiments have been done that has proven that the periodontal ligament, or say the periodontal ligament and the dental follicle complex, it is very important in tooth eruption. So just for knowledge sake, I'm going to tell you. So one of the experiment was that they transacted the root and they placed a metallic barrier. Let's say this is the metallic barrier, and the distal surface of the root, this one, let's say, it erupted because it was attached to the follicle. All right. So it was proven that the follicle is very important in the root eruption or tooth eruption. And few other experiments were done on rodents, and those teeth, to be precise, incisors, were designed in such a way that the effect of root growth and vascular supply were nil in them. Okay, so these experiments showed that as long as the pedial tissue is available, the tooth movement occurs. Okay, and third finding is that there are several deformities, or say diseases like multiple calcifying hyperplastic dental follicle. So in these cases, also what happens is there is delayed permanent tooth eruption. So now we have three findings which support that this periodontal ligament, or say the dental follicle pedial complex, is important for tooth eruption. Also, if you give some drugs which they interrupt the proper formation of collagen, then also the tooth eruption will be interfered. So all these experiments, they show that as long as the dental follicle or developing periodontal ligament exists, tooth eruption can actually occur. We also know that our fibroblast, let's say these are our fibroblasts, they have contractile properties. So they have the ability to contract and they transmit the contractile force to their extracellular environment. Okay, and in particular to the collagen fiber bundles. Also, these are in contact with one another. Hence, they form fibronexus. Okay, they exhibit fibronexus, by which such forces can be transmitted to the collagen fiber bundle. To imagine this, let's say we have our root here. Let's say we have collagen here, and let's say we have fibroblast here. So a simple analogy that has been given in urban histology is that this fibroblast is our sailor, okay? And it's pulling a rope, this blue rope, and this is the collagen, okay? And this rope is attached to a sail, and that is our tooth. The sail is our tooth, okay? Thus, according to this theory, eruption of teeth could be brought about by combination of events involving a force initiated by this fibroblast, and this force is transmitted to the extracellular compartment via the fibronexus that was created, okay, and to the collagen fiber bundle, which are aligned in a proper or appropriate inclination, and this brings about tooth movement. Also notice that these fiber bundles, they must have the ability to, align themselves in a proper way, because if there is interference in this ability to align, then the eruptive pathway is, hampered. The opponents of this theory have questioned the existence of fibronexus. So the existence is kind of questioned, and the junction which appear means these are joined to each other and they form fibronexus. Junction which appears, they seem to be desmosomes, okay, and they have no microfilament bundles. Therefore, these cells would not be able to transmit a tractional force that is required to pull the tooth in eruption. So in summary, eruptive movement is multifactorial, like vascular pressure will be at the apex, along with the contractile force that is generated by the dental follicle. So these all play an important role, and bone formation and resorption facilitate the process. So I hope this video was helpful. If you like the video, please don't forget to subscribe and press the bell icon and kindly share the video. I also have the part 1 of this video, so kindly go check out that video as well. Thanks for watching. Allah Hafiz.
Applications in dentistry. Cells with the characteristics of putative mesenchymal stem cells have been found in the regeneration of periodontal tissues, which implies their participation in periodontal regeneration. The properties of stem cells have also been observed in cells derived from other dental tissues, including the pulp of deciduous human teeth, and were found to have a high proliferative capacity and express related vascular markers such as basic fibroblast growth factor and endostatin. Furthermore, these cells are capable of generating robust bone in vivo. These findings suggest that the periodontal ligament of temporary and permanent teeth may constitute a source of stem cells for potential clinical applications. However, the clinical significance of phenotypic differences in progenitor cells, mesenchymal progenitor cells MPC, permanent periodontal ligament PEPDL, and deciduous periodontal ligament DEPDL remains to be investigated. Similarly, the identification and characterization of stem cells present in gingival tissue can also provide valuable information on the function and regeneration potential of this tissue to be applied in regenerative therapy. Gingival connective tissue may be another reservoir for MPC that could be used in tissue engineering-based periodontal regeneration procedures.
Hi, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan, and I want to talk a little bit about a possible future for dentistry, and it's regarding stem cells. There is research being done now at the University of Pennsylvania, at Tufts University, and I think other institutions around the United States, possibly around the world, on utilizing stem cells, human stem cells, to build and grow bone or revive actually dead teeth. Now, there are 5 different sources of stem cells in the mouth around teeth. There are stem cells from the ligament, or that's the tissue between the tooth and the bone. There are stem cells in the pulp or in the center of the tooth where the blood supply and the nerve are. There are stem cells around a follicle or a baby tooth that's developed before it comes into the mouth. And there are stem cells at the tips of the roots of teeth. So there are a number of sources of stem cells. These institutions are trying to see what they can develop with the stem cells. I think in some cases they're actually implanting them in the bone and actually growing teeth. Well, my ideal would be to take some of these stem cells, maybe from the ligament between the tooth and the bone, and somehow be able to activate them so that we can get new bone and new attachment to the tooth that's losing bone from gum disease. So once we clear up the infection, if we can stimulate stem cell growth in that area, which can then stimulate bone growth, it would be a huge, huge advance. And I think someday it may happen. Right now, we don't really have anything that is really practical for doing that, but there is ongoing research. I'm very interested in it. A friend of mine in Florida, Dr. McCauley, is very interested in it. We're going to be doing some more work and research to try to find more about what possibilities there are. And certainly I'm going to keep you updated on it. But I know stem cells are an exciting new area of research. People are interested in them. And I just wanted to talk about them a little bit and what is so far starting to happen in dentistry. Please join our YouTube channel, subscribe. We'd love to hear from you. Any comments or questions? I'll try to keep you abreast of everything that's going on in dentistry and maybe some things that are outside of dentistry. So keep your mouth healthy. You're going to have a healthier body. Have a great day.
Restore your smile and your health. Visit drnemeth.com to schedule your appointment.
Pros and cons. Populations of adult bone marrow-derived BMSC, dental pulp DPSC, and PDLSC like stromal, mesenchymal progenitor cells have the ability to differentiate into mesenchymal and non-mesenchymal tissue cells in vitro and in vivo. Culture-expanded mesenchymal-like stem cell populations are a heterogeneous mixture of committed progenitor cells that exhibit altered growth and developmental potentials. In one study, human PDL tissue was shown to contain 27% STRO1 positive cells with 3% strongly positive, with which the potential to regenerate periodontal tissues is concluded. Mesenchymal progenitor cells capable of forming fibroblasts, osteoblasts, and cementoblasts are involved for periodontal ligament repair. The complete and predictable regeneration of complex periodontal structures, including cementum, periodontal ligament, PDL, and alveolar bone, has been a major challenge for periodontal researchers. No cost was found in the investigation. Issue applied in Ecuador. With prior informed consent endorsed by the Bioethics Committee of the Faculty of Higher Studies, 36 healthy premolars were obtained by donation of patients from the orthodontic specialties clinic that belongs to the Faculty of Higher Studies. With the criteria described below, Only patients without systemic alterations, good periodontal health, first and second premolar teeth, both maxillary and mandibular left and right, were included. The exclusion criteria were patients with systemic diseases, patients with gingivitis and/or periodontal disease, premolars with the presence of dental calculus and/or the presence of caries and/or with a periapical reaction. Conclusion. The review and analysis of the present literature supports the possibility of using autologous CD146 plus stem progenitor cells in the periodontal ligament as a therapeutic measure to treat the sequelae of periodontitis in periodontal bone defects in humans.
Hello, my name is Li Xiao. I'm a lecturer of the Nippon Dental University in Japan. Here I'm going to introduce my article from regenerative dentistry to regenerative medicine, progress, challenges, and potential applications of oral stem cells. I hope you enjoy it. From regenerative dentistry to regenerative medicine, progress, challenges, and potential applications of oral stem cells. Oral stem cells include oral epithelial stem cells and oral mesenchymal stem cells. These cells can be isolated from oral tissue, including teeth and their surrounding or supporting tissue. In the daily dental clinical practice, there are many oral tissues exist from patients. They are usually disposed of as a hospital waste. In Japan alone, about 11 million teeth are disposed each year. However, these teeth and their surrounding tissue are not useless. They are treasures because we can get stem cells from them. Especially the deciduous teeth are more valuable because they can provide higher quality stem cells. Here is the human third molar wisdom tooth. When you cut the tooth like this, you can get dental pulp like this. From the dental pulp, we can easily obtain oral mesenchymal stem cells. The tissue attached to the surface of this tooth also provides oral stem cells. These oral stem cells are not only applied in regenerative dentistry, but also widely used in regenerative medicine. Here, I will talk about the current research about oral stem cells. Before we talk about oral stem cells, let's take a look about stem cells and organ formation. In an organism, all the tissues are built from pluripotent embryonic stem cells. The embryonic stem cells differentiate into multipotent stem cells, including epithelial, mesenchymal, and other tissue-specific stem cells. Interactions among these cells initiate and regulate developmental processes, resulting in the formation of highly specialized functional tissues and organs, such as tooth, hair follicle, lungs, kidneys, and other tubular organs. Once the organism matures, the pluripotent embryonic stem cells have vanished, and some multipotent adult stem cells remain in the developed tissue to sustain the homeostasis and repair injuries. Adult mesenchymal and epithelial stem cells remain in oral tissue. Here is a diagram of an immature tooth. From dental pulp, gingiva, and periodontal ligament, we can obtain mesenchymal stem cells, including dental pulp stem cells, EPSCs, stem cells from exfoliative deciduous teeth, SHED, stem cells from apical papilla, SCAP, periodontal ligament stem cell, PDLSCs, and mesenchymal stem cells from gingiva, GMSCs. From oral mucosal epithelium, epithelial stem cells can be isolated. During the past 2 decades, researchers have found that oral stem cells have potential for the regeneration of various tissues and organs. For example, oral epithelial stem cells have been demonstrated to repair corneal and esophageal epithelium mutations in animal models. Oral mesenchymal stem cells have a lot more applications in both regenerative dentistry and regenerative medicine. They have the capacity to give rise to cells that can help the regeneration of dental pulp, periodontal ligament tissue, neuron, bone, cartilage, muscle, blood vessel, liver, pancreas, and so on. Therefore, they have excellent regenerative ability. For more information, please go to directpress.com. Thank you for watching this presentation.